This question is, a 40-year-old male non-smoker presented with headache and dizziness. On examination, conjunctiva was congested and he had a ruddy complexion. CBC revealed HB of 18 grams per deciliter, WBC of 5000, platelet of 5 lakh. What is the cutoff level of hemoglobin above which you can call polycythemia according to the WHO classification of myeloproliferative neoplasms? So the question is quite straightforward. I just added a few clinical history to make you just familiar as to how they present. Okay, so it's a 40-year-old male with headache and dizziness with elevated hemoglobin level, and they've asked when do you call it as a polycythemia. Okay, so what do you mean by myeloproliferative neoplasms? So it will be proliferation of your myeloids. It is either your RBCs, your WBCs, or platelets. Okay, and why do they proliferate? Because they have uncontrolled growth stimulation. Even without certain stimulating growth factors, they keep on proliferating. At some point of time, they can transform into acute leukemias. They can lead to bone marrow fibrosis. That's why we are bothered about all these myeloproliferative disorders. Okay, so what are the diseases which are included under this myeloproliferative disorders or neoplasms? So you have your CML, chronic myeloid leukemia, your polycythemia vera, essential thrombocythemia, and primary myelofibrosis. Okay, so you have few others also, but as of now, remember these are chronic myeloproliferative disorders. So when do you call something as a polycythemia? Polycythemia basically means your increased red blood cells, which can lead to increased hematocrit. So previously we had different cutoff. Recently they have changed the cutoff. It's 16.5 grams per deciliter in men and more than 16 grams in women is considered polycythemia. Okay, so now when you take polycythemia, it could be due to many reasons. Okay, so if the person is a smoker, they can have polycythemia, or if you're living in a high altitude, you can have a polycythemia. And most important, polycythemia can be a paraneoplastic syndrome. Okay, it can be secondary to some underlying malignancies. So what malignancy can cause polycythemia? Your renal cell carcinoma can be associated with polycythemia. Any other thing which can manifest polycythemia as a paraneoplastic syndrome? Your cerebellar hemangioblastomas. Remember, RCC and cerebellar hemangioblastomas can have polycythemia as a paraneoplastic syndrome. So how do you differentiate all these causes of polycythemia from your chronic myeloproliferative neoplasms? So you have to differentiate whether it's due to a myeloproliferative neoplasm or secondary to any of these causes. Okay, so basically that's when they have devised a diagnostic criteria with various factors included. So one is HB of more than 16.5 gram in men and 16 in women, and you have major criteria and minor criteria. So whenever you have low erythropoietin levels, I told all these proliferate independent of the growth factors. Okay, so you don't need any stimulation. So your erythropoietin levels are low in case of polycythemia vera. This again is an important question, and this cutoff was asked 2 years back in JIPMER. Okay, so this cutoff is important, and serum levels of erythropoietin is low. Okay, so how can they present? Because of increased red cell mass, there is increased viscosity of your blood, which can lead to thrombosis. So you can have thrombosis. So where can this thrombosis happen? It can happen anywhere. It can happen in your hepatic veins, which can lead to Budd-Chiari syndrome. You can have stroke, you can have headache, you can have dizziness. So can they have bleeding manifestations? Yes or no? They can have. Why? Because the proliferating platelets are functionally abnormal. So they can have either bleeding or thrombosis, but thrombotic manifestations are common. So what you should remember is the cutoff for hemoglobin and low erythropoietin level as far as polycythemia vera is concerned. Thank you.